everybody. We are glad that you're here on this presidential evening to talk about sex work, and COVID-19. I am Michael Munson with Forge, and I'm thrilled that you're spending your night with us versus some other political realm, which you might do later. As you can hopefully see, we have ASL interpreters and we have cart captioning. So if you would like to access either of those things, you can pin the interpreter, or you can click on the CC for the cart captioning. I am going to be mostly your host tonight, and Dr. Petroll will take over in just a second, but I wanted to make sure that everybody knew their way around Zoom, which most of us do by now, and I wanted to make sure to thank our funder, who is the Advancing a Healthier Wisconsin Endowment at the Medical College of Wisconsin. I've said this several times, and I mean it more every time I say it, that I'm really grateful that we have a good partnership with the medical college, especially with the Inclusion Health Clinic, and we have done some really fun and interesting programming as a result of this funding. And we are very hopeful that some of the work that we've done together in these 6 months will continue beyond just these 6 months. So some other bits of information that y'all maybe would like to know before we start is that we're recording today. So when we get to questions and answers that may or may not influence whether you'd like to verbally ask or share in the chat, we can certainly edit out anything if someone has concerns around that. But we're recording it so people can watch it later if they would like. The one primary way that you can interact with us in terms of questions or comments is through the chat box. And I'm wondering if folks can find the chat box now. And how about answering the question of, when you think about sexuality and COVID-19, what is a word or two that comes to mind? So if you want to find the chat box and type in, when you think about sexuality and COVID-19, what is a word or two that comes to mind? So I'm seeing anxiety, getting closer, transmission. There can definitely be a wide range of feelings and thoughts associated with those two concepts pulled together. And hopefully we will talk a little bit about that as we move forward today. So our guest speaker today is Dr. Andy Petroll from the Medical College of Wisconsin. And I'm going to turn things over to you to introduce yourself more than just that one sentence and take us through the PowerPoint. Thank you.
Great. Sure. Thank you. Derek, you can hear me all right too? Okay. So true, I am on the faculty of the Medical College of Wisconsin. I am by training an infectious disease specialist, and I'm also the medical director of the Inclusion Health Clinic, which is an LGBTQ oriented multi-specialty clinic at Froedtert Hospital. And so thanks for chatting in your responses. Our topic for tonight, you can obviously see, and I think that is a topic that sometimes comes with anxiety of different sorts, and the goal of tonight is to alleviate anxiety of as much as we can by information and discussion and exchange of ideas. So a little bit of an outline of what we're going to talk about. So I'm going to give a brief COVID-19 update as of today, where we are in the US and in Wisconsin. And then we'll talk a little bit about how transmission of COVID-19 can be reduced around the setting of sex in general. And then I'm going to spend a little bit of time talking about some considerations around sex work with regard to COVID-19. I feel like this venue is usually a pretty safe space, but I wanted to make sure people know that this is a safe space to ask questions of any sort. Also, our discussion will be occurring using an affirmative and non-judgmental approach to sex work, especially. So any questions about that are welcome. The goal, of course, is to provide information that helps people reduce their likelihood of a negative health outcome from, sex or around COVID, and or maybe other health outcomes. I wanted to add in there a little kind of caveat that there are a lot of things that we still don't know about COVID-19. There's things that we do know, but the answers or the discussion will be around the best recommendations we have right now. So if anyone is watching this a year from now, you know, make sure to check elsewhere in case there are some updates. So with that, I'm going to go ahead with a little overview of how we're doing with COVID-19 right now. So first, I'm going to show you a couple tables or charts about where we are in the US right now. And so what you can see is that the initial kind of spike in cases that we saw back in March and April looked big at the time, but now does not look very big if you consider where we are. So we had kind of another increase in cases throughout July, and then we started doing a little better. And in the last couple weeks to month, we've seen another increase in cases. This is probably due to a number of factors. School reopening, colleges reopening, and a whole bunch of other things are probably related to that. And so this is for the US as a whole. And in case you don't follow along with where the hotspots are, I'll show you on the next slide. The darker the red color, the more cases per 100,000 people there are. And you can see that Wisconsin is quite red compared to many other parts of the country. So we have a lot of hotspots of COVID transmission right now. So I'm going to move into just a couple slides on Wisconsin. So the first is the number of new cases each day since March. And you can see that as of today, we have had, the last week has been the highest number of cases per day. And we now have the highest 7-day average since this started in March. So things are not looking so good here. This is a summary of the data that we have through today. So up through today, there were about 120,000 people in Wisconsin who've been diagnosed with COVID. About 7,200 people have been hospitalized for COVID. And as of today, a total of 1,300 people died from COVID. And so that's about 1% of all the people who had COVID died from it. As of today, there are 646 people currently in the hospital due to COVID, and this is the highest number we've had in Wisconsin so far, with about 200 people currently on a ventilator due to COVID. So this is probably is becoming more relevant as time goes on, that we talk about ways to reduce the chance of acquiring COVID. Okay, so first I'm just going to review some things that for most people who have been watching news or social media or anything like that already know, but it just felt like it was warranted to talk about it today just for a moment here. So the first is like maintaining distance. I don't like to call this social distancing. I like to call it physical distancing. When you can, staying at least 6 feet from people. Wearing a mask is a very easy and effective way to prevent the spread of COVID. Washing hands is another way, but perhaps a little bit less relevant than the first two. And the last one I called favor the outdoors, meaning that if there is an opportunity for you to be outside instead of inside when you're getting together with people, that would be the way to go, as long as you don't mind being outdoors. The weather is still fair, so hopefully that's an option. Okay, so we'll move on from there. That was probably old news to everybody. So I wanted to talk a little bit about sex in general with regard to COVID. So just a little bit about how COVID is transmitted, which related a little bit to what I mentioned before, but this is in a little bit more detail. So we know that COVID is most commonly transmitted through the inhalation of respiratory droplets that have come out of another person. This is both through just like regular talking, but of course, the chances of inhaling something go up when another person is yelling or singing or coughing or anything like that. As I mentioned, I hinted at, it's possible to transmit COVID through contact with surfaces, but that is a less common way of transmission than the respiratory route that we just covered. Coronavirus has been identified in semen and in stool, although we don't really know if it's transmissible that way at this point in time. It doesn't seem super likely to me because, I mean, it's definitely possible, but it doesn't seem like a likely route in that in order for viral particles to get down into your sinuses and into your lungs, these often have to be small particles that have been, like coughed by someone. And so, having COVID in stool where it's relatively, it's not in small particles that have been, coughed or otherwise breathed out or sneezed or anything like that, makes it seem much less likely, but possible. As long as we're on that topic, one concern is whether like public restrooms are a way of transmitting that, in that if there's COVID in stool and in an instance where you might encounter stool during sex, it probably is not aerosolized. Whereas in a restroom, when someone flushes the toilet, there are particles that are created through the flushing process. So right now, this is theoretical. We don't know a lot about it, but if you get a chance to use a restroom alone, that would be favorable to using a restroom with a whole bunch of toilets in the same room. Okay, so, and we talked about kind of the general ways of reducing transmission. So, how can we make sex a little bit safer during COVID, meaning how can we reduce the likelihood of getting COVID while we're having sex? And so there's a number of ways, and if you've attended one of these before, this is a slightly altered list from what we talked about last time. But of course, limiting the number of sex partners that you have outside of your household is one way to reduce the likelihood of getting COVID through sex. Sometimes that's possible and sometimes it's not. The other thing to do is to talk with potential sex partners about whether they have any symptoms at the time that you're planning to have sex with them. Of course, we know not everybody who has COVID has symptoms. So another line of discussion may be whether they have had any contact with anybody who could have had COVID. Whether, depending on where they work and what they do generally in their life. And if you uncover something where you think COVID is possible, you may defer on the time that you interact with that person. So another suggestion here is to minimize participation in larger groups. Larger groups generally, with regard to COVID transmission, mean that there are more likely to be one person in a room who has COVID. So the same would go for sex in larger groups, that the more people that are involved, the more likely one of the persons may have COVID in the group. As I mentioned before, with COVID generally, also applies here with regard to sex. So if there are safe and legal places to have sex outside, and I know it's getting a little bit colder, but those could be a way of reducing the likelihood of COVID transmission. If the use of a physical barrier, there are other slang terms for that, like glory hole or other things, is possible and enjoyable, that is actually probably the way to reduce COVID transmission the most. So other things to do are to consider wearing a mask. Of course, masks can be fun and interesting also. And then avoiding kissing, right? Because that's an instance where people's like noses and mouths are in very close proximity. So that's a way that COVID could be really easily transmitted. Washing hands afterwards. And then, of course, like if you're thinking about the likelihood of you giving COVID to someone else, just, obviously if you don't feel well, that would be a time to defer on sex if that's possible. And then getting tested for COVID if you have any concerns about either having symptoms yourself or if you've been around anybody who you who you know has had COVID or who you think might have had COVID, that would be a great time to get a test. And then if you can, defer on sex until your test result is back. Okay. I know there may be fun questions about this. Maybe we'll just keep going and get to questions in a little while. I think we'll have a lot of time for questions because I didn't overdo it with the slides today. Well, we'll see. Other things to think about, what are lower risk activities with regard to transmission of COVID? Of course, not seeing someone in person is one way to reduce the risk of COVID. So obviously, like online or video or phone methods of having sex are lower risk. Mutual masturbation would be a way of having relatively low in-person interactions, sexual interactions, with decreasing the risk of COVID. Using condoms or dental dams may be of use. As I mentioned before, we don't know about COVID transmission through body fluids yet, so it's still something to consider in the meantime. And then, as I mentioned, like kissing is probably the highest, the most likely way to get COVID when you're interacting with a person. Rimming might be another way of getting it, although, as I mentioned, we don't know a lot about that yet. Okay, so I wanted to talk a little bit more about sex work in light of COVID-19. So first, a few just general considerations about sex work. I think it's important to just stop and recognize first that many people who engage in sex work have been, sometimes severely impacted by COVID-19. And this can be due to a number of factors. Of course, there can be a decrease in the demand for in-person sex work right now, and even the venues where that may be possible. People with the downturn in the economy, clients may also have been impacted by the financial downturn and have less money available themselves. Of course, some people may have concerns about COVID and may be avoiding sex generally, which could also impact the amount of clients that are available. And in many cases, some venues where initiation of sex work and sex worker and client interactions may have started, like bars and other clubs, have closed either temporarily or in some cases, we've lost businesses permanently. So that has affected people who do sex work. And I think this is a fair time to also acknowledge that our society, many of the safety nets that our society has are not really geared to protect sex workers. For instance, our unemployment system is really not geared towards protecting sex workers who are out of work. And I think pretty egregiously, some of the small business funding that was enacted with regard to funds that would protect people from losing work or who were going to lose work during COVID, these explicitly excluded sex workers and sex venues who had employees. So that's definitely kind of a way that our safety net has discriminated against people who engage in sex work. And then, of course, there is just a general health threat of getting COVID-19 for people who engage in sex work and the effect of that potentially on their own health and well-being and their ability to do work if they would happen to get COVID, which would kind of stop them from working at least temporarily. I think that some of the other things that have affected people who do sex work is that there may be, in some cases, increased or different types of demands from clientele, meaning some clients may have perhaps more emotional needs right now and may want emotional support in addition to, or perhaps instead of sex that they may have gotten from their sex worker previously. And so that may create different stress for for people who engage in sex work. There are probably two sides to everything. It's always hard to find something optimistic to say in kind of the current era, but of course, there are opportunities to take sex work into virtual platforms, such as online. Of course, there are a lot of challenges associated with that. There may be different clientele, not the same people using these platforms compared to in other spaces. And it does require a different skill set. So having an online presence is a lot different, and maintaining a presence and doing marketing and all those things is a lot. These are skills that people may need to acquire if they're trying to move into an online space. And of course, being online is associated with costs as well for marketing and upkeep of whatever electronic platform someone may use. In other cases, as I mentioned before a little bit, there may be an increased demand for services in that people are now experiencing a lot of loneliness and depression and anxiety generally. And so they may, in some cases, be looking more toward people who do sex work for help with some of those feelings, some of which may be, as I mentioned, like more talking. Sometimes people just want physical touch, and with or without sex. So that is, something that people who do sex work may have to adjust to, since it may require more discussion and talking and emotional support, which can be challenging on people too. So those are some differences that are occurring now.
While we kind of give a little bit of space for folks to ask questions, I have a question or two to get us rolling, if that is okay. So these are the surprise questions that Dr. Petroll doesn't know about. So let me start with a question that's going to also give some stats. So if we know from the US Trans Survey that around 19% of trans people have engaged in sex work at some point, versus 1% of the population that's not trans that provide sex work. And of those 19%, 50% are trans women, 30% are non-binary folks, and 19% are trans men. What might there be in terms of special considerations, unique considerations for trans women, sex work in COVID, trans men, sex work in COVID, non-binary folks, sex work in COVID? Is there any differences to what you've said based on those three population groups?
Yeah, that's a good surprise question, Michael. I'm not sure that there would be many differences in that, the main risk in COVID transmission is really just being in the same space with somebody. And of course, as we know, like any space closer than 6 feet is, which, nobody is like 12 feet tall. So it's really hard to engage in much of anything without being inside of that space. So I'm not really sure how much differences there would be between those groups and what someone could do differently if they were in one or other of those groups.
Because one of the things that I thought about is, I know you used a different word for this, but the kind of the glory hole barriers, that would be harder for folks that didn't have external genitals that were could fit easily through those spaces. So that might be that's one of the differences that I could think about in terms of that would not be as available.
Sure, and I guess, I kind of thought of that, but it really depends on what type of intersex interaction was desired, So it could work depending on, who's involved.
Exactly.
on both ends or both sides of the barrier.
So I'm thinking a little bit about trans youth and how there's higher rates of homelessness for trans youth and pretty high rates of sex work among trans youth out of survival needs, not necessarily by choice. And I'm wondering if you think that there's maybe a lesser information that goes to trans youth, especially if youth are on the streets and maybe not seeing the news and not knowing what some of those protocols are, and what we can do as adults or people that may have contact with those youth to try to help inform them of risks and also solutions.
Yeah. I mean, I think the thing that we could all do, which is not easy to do, is to try to fix those problems, right? The fact that more trans youth are out homeless, that they're in the situation in the first place, are things that we should try to do, like housing, obviously, like, providing someone with a place to stay can sometimes alleviate those other things and gets them into a space where they can consider like learning more about topics like this, and having kind of the luxury of caring about these topics, as opposed to when someone is in a spot where they really thinking about those are just like, that's kind of icing on the cake compared to like having a place to stay. So I'm not sure, other than helping, anybody who's in that situation, homeless or otherwise kind of having a rough time financially or emotionally with those primary issues. Beyond that, I'm not sure how effective some of these other messages may be.
That's great. Thank you. Yeah. And as you were talking, I was thinking about some of the mutual aid that's happening right now. And, a lot of that's focused around food and housing. But, I think a lot of the mutual aid is also focused on making sure that people have masks or people have other supplies that can help keep them safer. So that might be something that we want to, think about in terms of where are youth accessing food or other things that sustain them, and can we make sure that we have appropriate supplies for them in those locations as well. So
And I think as long as you're on that topic, right, making those places where people, like if you're talking about trans youth, go for like food or other supplies, making sure those spaces are okay places to ask these kind of questions whenever that's possible, it would be helpful and not easy necessarily to accomplish.
right, especially not overnight. There's a question in the chat, and the question is there a fluctuation in cases with sex workers currently? That's a good question.
This is a great question. And I have, in preparation for us having this discussion, tried to read everything I could find on the topic. And as far as I can tell, there has been nothing in the epidemiologic data that is put out by states and federal government that has identified anything about occupation or otherwise that is available that would suggest a higher risk for people who do sex work. I don't believe that that is part of the data collection. They do contact tracing with new cases, and they ask about interactions that people have had with other people. They may ask about employment, but if I were faced with talking to a contact tracer, I'm not sure I would decide to tell them that I was doing sex work. So basically, I don't believe that there's a lot of information on sex workers and COVID-19. But it's a great question.
Yeah. And it's not related to the question, but I did put in one of the resources that I was able to find about sex workers and LGBTQ folks and COVID. So it's an interesting guide, but it doesn't talk about prevalence at all.
Sure. And, of course, we know this from a lot of different things. The more we criminalize different behaviors, like the less likely we are to have better health outcomes for the people that are doing those behaviors. So, rather than criminalizing people who do sex work, this would be a great place to interact with people, offer COVID tests, help them stay healthier, things like that. So yeah, criminalization rarely results in better health outcomes. So yeah.
And one of the things that you and I talked about before this session was, some of my concerns, which are just, they're questions more so than in reality about our, law enforcement cracking down more on things that they view as criminal behavior? Are law enforcement just kind of upset because there's a lot of anti-law enforcement activity going on? So I mean, this isn't more. It's more of a thought than a question around just how is law enforcement interacting with folks that are doing something that is viewed as illegal, even though I think many of us think it should not be. So, do you have any comments on that, or?
No, I don't. I Yeah, I don't know if anyone is tracking those types of interactions as far as like higher arrests for sex work right now. I just don't know about that.
Yeah. And part of me had thought, well, gee, I hope that the cops are busy doing other things. And then I'm like, no, I don't hope the cops are busy doing other things, because what they're doing is not necessarily very helpful to our world. So yeah, kind of a mixed bag there. Other questions that folks have. Because one of the questions that I thought of as you were talking, and you mentioned this already, is that if it's safer to be outside than inside. Most sex work, a lot of sex work is done inside for privacy reasons, for safety reasons. There's not a lot of safe places to have sex outside, and it gets cold. Do you have some recommendations as to, like, if it's not even outside, what are some spaces that might be better than like in a hotel room or in a bathroom or in a bedroom?
I mean, I guess that the same concept would hold, that anytime there are more like windows or there's a larger space available to interact in, that would be safer, right? So if there's a space that has a bunch of windows and they could be opened, even if it's kind of like a day like today, you can open some windows and get more airflow, and that the more airflow, the less likely that someone would transmit COVID in an interaction. So yeah, I think larger spaces and spaces that have access to open air when
Okay,
possible.
so somebody could crank up their heat and have their window cracked a little bit so it would have fresh air going in and out but still stay warm. That'd be safer than.
Agreed.
Okay,
Yes,
that would cost more money, but that's still an option that people
that's
could take.
fair enough.
What questions do people have? I still have a couple more on my list, but again, we don't need to talk about my random questions. So another question that I had was, you talked earlier about how there aren't a lot of protective rights for folks that are engaging in sex work. So there's not necessarily unemployment. I was thinking that there's also oftentimes not health insurance. If somebody is self-employed doing sex work, they may not have insurance coverage. And so kind of what's the weighing of like, oh my God, if I do this, I'm going to get sick and I don't have health insurance. And, are there options, are there public options if people do get sick that they can receive medical care?
Sure. So actually, the thresholds for getting on Badger Care or Medicaid in Wisconsin, I don't have these numbers memorized, but it's actually probably lower than people might think, or I guess higher than people might think. So depending on which way you're looking at it. So a lot of people are eligible for getting on Badger Care, but don't know that they're eligible. And that is, really great insurance, has really low co-payments for visits and medications. For instance, co-pays on medications for people on Badger Care are either $1 or $3 if it's a higher tier medication, which is quite low compared to insurance, other like commercial insurances. So oftentimes, if we have people call clinic or when we run into people in other settings who don't have insurance right now, many times they're eligible and just need to be assisted with finding the online application for that, and could likely be eligible to get on it. So that's our first line of engagement or advice when we encounter people without insurance. If people make more money than the threshold for getting on Badger Care, but not, a lot more money, oftentimes they are eligible for subsidies through the Affordable Care Act, where they'll get onto commercial health insurance, but have some or all of the premium for that covered through, a tax refund. Don't pretend to be a social worker, but from being around social workers a lot, I picked up a lot of these things. So it's hard to understand all these benefits. So we help people whenever we can that we encounter at our clinic to understand them and get them engaged and getting whatever they're eligible for.
And I also put in Shelley Gregory's contact information. Shelley is on our staff and is the person that knows more than probably anybody else on our staff about accessing Badger Care or other forms of health insurance or assistance. So both the Inclusion Clinic and Forge can help people establish some of those routes of care if needed. And I don't have very many more questions. I've got one question, and it's maybe, again, it's more of a comment than a question. But as you were talking, I was thinking about different forms of sex work, and I was thinking about physical forms of sex work versus camera or virtual. And I was thinking that folks that engage in BDSM might be more likely to try to advertise that part of their service so that they could engage in hoods or masks or face coverings as, part of the play, which would then end up making it safer for both people or multiple people. So I was thinking that people could, if you're gonna have to change your practice a little bit, change your work, that might be a way that people could engage and play with it. And I was thinking about, like, in the middle of the AIDS crisis, how condoms became something that was like a playful activity. And so I'm wondering if if mask wearing or distance or whatever could be seen as more playful.
Yeah,
Or fun.
I mean, great idea, Michael.
What else could they do?
I mean, right, it doesn't really matter what is covering someone's nose and mouth that could be of interest. So there could be a lot of creative things that cover the nose and mouth.
Fair enough. And that I will not put you on the spot any more than that. But so those are some of the questions that I had. I see there's another question here.
Yeah.
So the question is, I keep seeing infectious disease physicians saying that wearing a mask is more effective to fight the spread of COVID-19 than any vaccine would be. Why is that?
Okay. Now, I haven't heard anyone exactly saying that, so I don't know what they're getting at exactly, but I will, we'll go from here. Well, of course, currently, there is no effective vaccine that we have available. So at least for the next, it's anyone's guess, but my personal guess is it's going to be many months before we would have a vaccine available. So right now, all we have are masks and the other methods of prevention that we discussed today. But to move on with the other part of that question, when vaccines come out and get approved, there are a wide range of effectiveness of vaccines that get approved. So some vaccines may get approved if they reduce the likelihood of transmission by 50%. So wearing a mask may be, and we don't know the exact effectiveness of masks, but if two people are wearing a mask, the likelihood of transmission may be less than 50%. So masks are pretty reliable as far as we understand now, and a vaccine is one not currently available and uncertain efficacy right now. Of course, we'll know when a vaccine makes it through and approved, we'll know how effective that may be, at least in the population that it was tested in. I think maybe, without reading the article that you put on here, which thank you for that, is that even if we do our very best to disseminate the vaccine, it's going to take quite a while to disseminate the vaccine to enough people where it's effective. If you think, okay, there's 350 million people in the U.S., we would have to get that vaccine out, to hundreds of millions of people before we would see, an effect on COVID transmission or a reduction in transmission, especially if the effectiveness of the vaccine is only, let's say 50%, that it's going to take more people before it has an effect on the population spread of COVID. So I think that's probably what they were getting at. And the other thing is that we will need to get the vaccines to the people who need it the most, who are kind of at higher or already at higher risk for COVID. And that may include LGBTQ people and people of color. And oftentimes, these populations are perhaps less willing to engage or have less access to medical systems. We don't necessarily need medical systems for vaccine distribution, but that's often how they're distributed. And there is often mistrust of health systems and medicine generally in a subset of these populations. So I think the culmination of all of those random ideas is that it may be hard to get the vaccine out in to the number of people that we need to get it before it's effective. So I think, having a vaccine is nowhere near what we need to do to have a change in COVID transmission. We have to have a vaccine that's effective and safe, and we have to have a majority of people want and get the vaccine. So we're definitely a long ways off from that.
Another question that's coming in is there any study or research that proves the effectiveness of mask and social distances?
Sure. Yeah, so this has been done in a couple of ways. So one is that people have looked at the distance that expired particles travel on people who are and are not wearing masks. And so what they've shown is that the distance that these particles travel, even when people are wearing simple masks, is much, much shorter. Like really, there's just a little kind of cloud around a person's face. Whereas if someone is not wearing a mask, as we've heard a whole bunch of times, these particles can travel up to 6 feet or more in some cases, depending on the activity. As I mentioned, like singing, coughing, yelling, things like that. The other thing that we know is that in population studies that mask wearing has been associated with lower risk of COVID. So this isn't like where someone has put a person with COVID in a room with people who are or are not wearing masks and seen if there's a change in the transmission. This is more like what we call epidemiologic studies, where cities or states that have implemented masking, or places that have where the uptake of mask wearing is higher, seem to have lower transmission of COVID. So these epidemiologic studies are often how we learn about things like that the fastest, as opposed to like direct studies of putting people in a room and measuring like how many people out of the 10 people who weren't wearing a mask or were wearing the mask get COVID. That was a really long answer to your question, but thanks for asking that.
That's really great. So this person is asking again, in the beginning of the pandemic, there was a lot of talk of dying at a certain degree. Is that still true? And does the virus still continue to live on surfaces for any given amount of time?
Yeah. So as you probably heard, but I'll just say it for other people who may not have seen the same things. There were some studies that looked at if someone, let's just say, sneezes onto a countertop or a door handle, how long does that virus stay alive? on different surfaces. And, the bad news was that it may stay alive for like 1 to 3 days on hard surfaces, and surfaces like paper or things like that, where like the droplet probably won't stay intact as well. It's much shorter, like hours or less, that the virus particle stays alive. And so, to my knowledge, there hasn't been a lot more exploration of that. But what seems to be happening over time is that the role of surfaces in transmission, it seems to be less of an issue than people thought initially. And this comes, again, similarly from when they do contact tracing and they discover like how people get COVID. There seems to be, most of the time, direct contact in a space with a person who has COVID, and not very often that someone has no clue how they got it, or that they may have gotten it from a surface that they touched and then kind of spread into their face. So that's how this has kind of faded a little bit into the background as the major route of transmission.
You know about who did the studies, who's conducted those studies?
Off the top of my head, I could not quote you on that. These are, there's like kind of a flood of information coming in like every day. So I could not tell you off the top of my head any of the studies that I'm mentioning, but these are amongst the flood of new information that we see on a daily basis. It's hard to absorb this much information right now and put it all together and have like direct references, but yeah. So.
This question really made me think about something else about surfaces, and so I'm going to ask a sexually explicit question, so warning for anybody's ears. So I was thinking about if when people are having sex, there's oftentimes really heavy breathing. People may have more particles in the air, and I'm wondering if somebody ends up with particles on their arm or another part of their body, and then there's licking or kissing involved that goes on that part of the body. Is that, I don't want to say a viable method of transmission, but how would you
Yeah,
rate that in terms of, risk?
if you compared the risk of, being in the room and breathing the air that someone else is expiring to, the likelihood of not getting it that way, but then getting it off of a surface like someone's skin or otherwise, or even if we're talking about someone's, anus or their urethra or other, since we discussed that there can be COVID in stool and in semen, that those are just much less likely compared to the risk of just being in the space with a person who, if that person has COVID.
And that makes me think of, so if there's COVID in semen, and if somebody ejaculates and it's not into someone or something, is that aerosolized more than, what role does that play?
Yeah, now this is not an area that I've spent a lot of time in studying, which is the aerosolization of ejaculation. But compared to the force at which air comes out of between our vocal cords when we're coughing or singing or yelling, the force at which fluid comes out of the urethra pales in comparison to that. So I don't know this, but I would guess that aerosolization from ejaculation is minimal.
Okay, that makes sense. And it's thicker than saliva and all of that other stuff too. So another question in the chat, maybe this is probably our last question given our time. So it says, I've seen several articles on sex and the coronavirus, and yet none include guidelines for those who have extremely high risk for complications because of pre-existing conditions. Is sex okay for these groups? Is it better to avoid altogether?
Sure, okay. So thanks, Ash. So what I would say is that if a person does have a high risk for complications of COVID, so people with lung disease like asthma or other things, then it's not as though they couldn't have sex, but I would kind of recommend some of the things that were on the top part of that one slide, which is minimizing the number of sex partners and having sex within, if possible, like, a closed circle of people who are all doing their best to try to minimize their own risk to getting COVID. So, if the question was, if I'm a person who has high risk for complication, should I have sex with somebody that I don't know and I don't know about their likelihood of having COVID? Then yeah, I would discourage this person from having sex with someone where they didn't really know how likely the person was to have COVID, when that's possible. So, I like to look at this all in a matter of degree, and that people sometimes have, either opportunity or like the need to have sex in different situations. And yes, so the answer is yes. If a person had some conditions like you're mentioning, and they could avoid sex altogether, that would be fine. But for how long we can go without avoiding sex or needing to have sex for various reasons is different for everybody.
That's a really good question. I think, when we bring it back to sex work, if people are depending on work for a roof over their head or food,
Right.
there may not be the option of like saying, oh, I have to screen everybody, or I have to like not engage in work because they have to eat and they have to have housing. So, those are one of those things about which risk is higher or what's worse for my own personal wellness. And those are hard choices that we'd have to make sometimes. Do you have some thoughts that you'd like to end with before we wrap up tonight?
I guess what I would emphasize is that, if people have questions like this, they can reach out to you, Michael, at Forge, and that, with our partnership, we can help people with some specific questions if they have questions about their own situation. We can't give like medical advice that way, but we can give our best suggestions to people that way. And I would say that although I feel like people have been kind of, burnt out on caring about COVID, now is the time to care about it more than we cared about it 6 months ago when it first came, because I showed the slides towards the beginning of this talk that it's becoming more common now than it ever has been in Wisconsin in the last 6 months. So this is the right time to care about it more, even though we may have some fatigue around COVID.
Excellent. And I'm just sticking a few resources that are not all COVID specific. None of them are COVID specific, but they're sex worker specific and trans focused. So in case if people would like more general information about trans folks and sex work. I really appreciate you spending your evening with us, Dr. Petroll, and maybe avoiding the presidential debates or not. I think we still have time to all rush home and enjoy that if we feel like it. But thank you for spending your time and preparing for tonight and having conversations that we don't have very often about sex and sex work and COVID. And for everybody who joined us tonight, we really appreciate your being here and being part of this conversation. And we look forward to having more of these conversations, whether it's about sex work or about other forms of relationships around COVID and how we can keep ourselves safer. Thank you everybody for being here. Thank you, Jill and Derek, for interpreting, and our card captioner. Thank you very much. Thanks, Andy.
Okay.
Have a good night, everybody.
Take care.